Mental health in itself, probably a lot of people would see that as mental illness. But to us, mental health is the holistic approach, that mental health is a balance of the physical, mental, and spiritual aspects of one's life. As a new immigrant, a lot of times probably we are busy spending time looking after physical health and our day-to-day life needs. And a lot of times we forgot about that actually there should be a balance. And that's what we are trying to look at.
我也同大家來做拍手谷。
សុខភាពស្ថិរអារម្មណ៍សម្រាប់យើងទាំងអស់គ្នា
精神健康你与我，精神健康你与我
모두의 정신 건강을 증진시킵니다.
Sức khỏe tâm thần cho tất cả mọi người.
The mission is actually consistent with why we started Fook in the first place, because we felt at that time, in 1970s, that patients who don't speak English had a hard time getting services.
កិច្ចបម្រើស្មើភាពគ្នា
平等機會使用服務，平等機會使用服務
서비스 접근과 이용의 동등을 주창합니다.
Quyền sử dụng dịch vụ được bình đẳng.
And that is still true, because to navigate in this complex service system, not only do you need language skills, you also need knowledge. I think equal access for all is important, because from the equality basis, we are all contributing Canadian citizens. And we feel that the services should be available to everybody, regardless of culture, language, and other barriers.
ការគ្រប់គ្រង
提倡病人權益，提倡病人權益
그리고 이런 것들을 변호, 옹호합니다.
Bênh vực quyền lợi cho thân chủ.
At that time, we could have just started a clinic and then see patients, provide what we call direct service. We do the counseling, give the medications. So that would be one way. But somehow we were not happy acting in that role. We kind of feel that we could be the dumping ground for the mainstream, who then have a very good reason not to provide even any more service to the Chinese. So we decided that we need to continue to relate to the mainstream, making sure that they do what they can and we assist them. So that is how we became what we call the consultation liaison model, where our staff they would go to the hospital to provide interpretation, but beyond that also consultation, in the sense of giving them ideas as to what would work, what are resources available, and how they can deal with the family. A lot of times our staff are intimately involved with the families.
我哋病嗰陣時呢，佢真係講頭痛、發燒係咁耐，咁又送佢去嗰個醫院，醫院呢時才半個月就得7元，又俾介紹你翻嚟買藥食咯，係去家庭醫生。家庭醫生呢又去呢個專科醫生，係咁呢，我哋都冇識得啲嗰個病情，咁家下呢又得到康復幫忙，我個呢病情呢都好。
Hospital tend not to keep the patient in the hospital long. The hospital would call us, send a referral, then there will be a caseworker working one-on-one with that patient in the community.
即係有個地邊呢，咁今次呢會去，咁住家庭呢人多，咁佢出來自己揾屋住，通過你，咁今次呢就得到護士來幫忙嘅，係咁康復呢就幫佢揾得屋。一房屋俾佢仔乸住。
We provide housing and also case management service at the same time. You know that most of the people with mental illness is also they facing the problem with homelessness. We don't own any building. However, we have a funding to have a team of housing mental health workers to go out there, go to the market to negotiate and rent the apartment in the private marketplace. We will find a place for them, subcontract back to the client, and subsidize on the top of the shelter allowance that the patient has.
I think the mutual help support concept is very important. We cannot live alone here as a new immigrant, but we need to know others are sharing the same experience by sharing with each other, and that is the best way also to promote mental health.
我进来以后，这个组织的活动还是好像挺多的，平常搞得比较多的，像讲座呀，老人的身心健康的讲座呀，还有老人的福利的讲座呀，搞得挺好的。还有一些活动里，像这个秋游啊、参观啊、访问啊，日常的每个星期有一次活动，每个新的活动就也是很丰富的。有老人到这来了以后，有的是唱歌呀、跳舞啊，这个还有画画呀，再就是打牌呀、下棋呀、打乒乓球啊，很多的，还有闲聊、看报纸都有，反正很好的。这个参加活动之前呢，就是老是关在家里。我们刚来的时候语言也不通啊，又不会英语，在平常呢很少出门，也没有朋友在这个地方。刚来嘛，就是很孤独、很寂寞的，心情也不愉快，老是在家里闷着。小孩子们他觉得也好像没什么办法，后来听这个参加这个组织以后呢，就交了很多老的朋友，在这个活动也丰富多彩，所以就慢慢的呢就心情也舒畅，现在都感到很开心，跟我们一起玩的一些老人也都感到很开心的。
Well, especially as an immigrant living in this society, access equity means a lot. Once we are accepted as a Canadian in this new country, we are doing our duty equally. We are expected to do our duty equally as other Canadians do. But because of many barriers, we cannot enjoy the right of the Canadian here. So, for example, to access to health care, it's really hard for immigrants to access equally to the public health care because of language barrier, culture barrier, unfamiliarity to the system, and all service provided by government.
Đầu mới qua thì khó khăn, đến xứ lạ thì hơi bỡ ngỡ, rồi ngôn ngữ bất đồng, rồi thời tiết nó khác, lạnh thành nó đi đâu thì cũng hơi khó khăn, thành nó lạ quá thì nó hơi bỡ ngỡ. Con tôi là 7 đứa. Bởi vì mình có cái gì mình tâm sự mình nói cũng dễ dàng. Cũng thích chứ. Bởi vì nó đồng ngôn ngữ, nói chuyện nó dễ dàng, thành tôi rất là thích. Tôi rất mừng. Tưởng qua bên đây tiếng Anh không.
As an organization, we want to make sure that major hospitals, mental health centers, or educational organizations would have materials whereby the 6 communities would understand, and that they are culturally appropriate, because a lot of terms used might not be sensitive enough for the communities to understand.
Another duty is also do the promotion and prevention work, reach out to the community and then to help the community to learn more about mental health. and also we have developed a lot of educational material, and also I have a lot of group activity for the community member to come and then to have a mutual support as well.
Hong Fook doesn't want to become a service organization by providing the full scope of services on our own. We would like to partner and with the other organizations so that they can provide the services that they are specialized in to the communities that we are targeted for. So basically, we would like to see that other organizations can become a little bit more cultural competent and be able to provide service to the target communities that we are working with in a language and in a culturally competent way.